Today's episode of the StallSide podcast was brought to you by Root and Riddle Veterinary Pharmacy.
How you doing today, Bart?
It's an excellent day. How about you?
It's a really good day. Very excited today. We have our ophthalmologist, Dr. Kim Lam, coming in to see us.
Yeah, she's just started with the practice and very excited to have her here. You know, that's one of those things as a veterinarian when you are, we deal with a lot of eye stuff, but boy, they can get complicated really, really quick. And I'm so grateful to have somebody who is so focused and has such a large array of expertise that she can rely on, that you can call in and help you out.
Yeah, you hit the nail on the head. Eyes can go bad really quickly. You don't get too many second chances with an eye.
No,
and you
don't.
can be just a few hours from, what's going on here, to an irretrievable situation. So, yeah, I'm really excited that she's in the practice. And I think that there's going to be a lot of, learning, go backwards and forwards, and she's going to lift everybody's boat.
Yep. We've had a lot of great experience with Dr. Latimer, and now Dr. Lam is joining us too, and I couldn't be happier.
Yeah, really good. So at StallSide this week, we're going to be talking to Dr. Kim Lam about her ophthalmology skills, especially corneal ulceration with a focus on fungal. Dr. Lam, welcome to StallSide.
Thank you for having me.
Thank you for joining us today, and thrilled to have you in the practice. It's good to have you here and introduce you to everybody. We're looking forward to lots of years together.
Mm-hmm, me too.
Absolutely. So Kim, tell us a little bit about yourself.
I'm Canadian. I'm originally from the Toronto area, and I did my vet school actually in Australia at the University of Queensland, and I loved it in Australia. It was a 5-year program, and then I came back to the United States and I did an internship at Tufts University, and that's where I kind of found my passion for ophthalmology. I did a large animal medicine and equine ambulatory, and it just happened that we did a lot of eyes, and then that kind of brought my interest in it, and then did a lot of years at Auburn. I did my residency there, I did my specialty internships, and then I ended up here.
Yeah, well, as Bart said, we're really glad to have you here. Also, Toronto, you've been up the Canada National Tower?
Yes.
Yeah. Have you ever been up?
No.
Oh, man, that place just terrified me. Like, it was years ago I was up there, and got that glass floor where you just, walk out over space, and it took me about 20 minutes to walk onto that glass. And there were people jumping up and down on it and, taking selfies, over there, and I just couldn't do it.
Yeah.
I just couldn't walk out over that. So I have to go back there one day to just get over that.
So you never did it?
Oh, I did eventually.
Oh, you did?
I walked out
20 minutes.
Took a picture of my feet and then just walked back again because, I'll just have to break that for you. So, we're really glad you're here. And because there's a lot of horses, there's a lot of eyes. And so what would you like to tell us about corneal ulcers today?
So that's probably one of the most common problems that we deal with in ophthalmology in any species is definitely corneal ulcers. Horses specifically, they are just the perfect specimen to have an ocular injury. They've got large eyes. They get spooked quite easily from anything in the environment. And also the environment that they live in just kind of increases their chances of injury. And we do see a lot of infection, specifically bacterial and also fungal. And that is also location dependent as well, too.
Yeah, so you say it's location dependent, and probably implying that Kentucky's bad for that. So what specifically about the environment around here makes this such a hotbed for fungal ulcers?
So my time here and also my time down south at Auburn, it's just, we have humidity in the air. It gets warm, it gets hot, and that is just a perfect area for bacteria and fungal organisms to just kind of proliferate through. I also think about, just the barn environment as well. We've got horses that are stalled in areas that just may not have a lot of ventilation. And so when it's hot and humid in the barn, they stick their head down to eat some hay. There's a lot of particulates in the air that are getting into their eyes. And, that just increase the risks for something bad to happen.
You mentioned about injuries. Is that more likely to cause, just day-to-day wear and tear or any injuries, is that more likely to promote the onset of bacterial or fungal ulcers?
Definitely, for sure. there usually is a predisposing factor for why these animals are getting an ulcer. And a lot of what we're seeing, especially in the horses, is trauma related. But we also have to think about, the health of the eye itself. If their tear film is deficient, maybe they're not producing enough tears, or maybe their tear quality is just not as good, that decreases the immunity of the eye itself and the ability to fight off that infection, So I think it's a combination of, looking at ocular health itself and also the environmental factors at play.
Yeah, just picking up on that. I mean, I have no trouble producing tears around here every day, especially when I've got to work with this guy. So what factors would affect tear production? Because that's probably something people don't think of a lot as being protective to the eye.
Yeah, so the tears are very important because, obviously we keep things lubricated, keep everything comfortable, but there are normal organisms that live in the tear film as well, too. If you're not producing enough tears, you're not having enough protection. So your corneal surface is drying out, you stare outside too much and it's windy, your eyes start to tear a little bit, and that's just kind of the protective aspect of the eye itself. If we're not able to produce enough tears, we don't have that protective ability. And if our tear quality is poor, so let's say we don't have the fat that's within the tears that, we need to coat the surface of the eye, that is also going to be a risk factor for just not having adequate protection. And that's a lot of the time what we're dealing with these cases is, have they had some sort of trauma? Do they have a lack of tear production? It's hard to know, but it's all one system kind of together thinking about it.
Yeah. So if we have a situation where the eye has been predisposed to infection and an infection of any type starts to take root, what are we going to see as the first signs? What do owners need to be looking for to say, hey, my eyes and my horse is not right? And what would lead them to sort of think, hey, maybe I have an ulcer? How do those first appear?
Yeah, so the biggest thing that most of our owners are going to pick up is just the appearance of the eye itself. When you look at the horse straight on, you expect, eyelashes to be pointing upwards. But a lot of the times when they're uncomfortable, those eyelashes start to point down towards the ground. You'll see the eye itself is not as open as it normally is. Maybe they're closing it a little bit more. Maybe they're squinting it, keeping it closed. And they may notice more discharge coming from the eye, whether it's tears, so just wetness on the face. And sometimes you'll see even more of like thicker material coming from the eye, whether it's like a mucoid discharge. They may also notice, that they're just shy on that side too. And if that horse had never really had that behavior before, that might be indicating that it's having discomfort on that side. And a lot of the times, they're got really strong eyelids, so it's hard to look at the eye itself, but those changes you'll be able to pick up: swelling, redness, increased discharge.
So if an owner is concerned that there may be something going on with the horse's eye and they call you to have a look at that, what's your approach to diagnosing that eye? What are the steps you go through to be systematic to find out all the things that you need to find out?
Yeah, so it's definitely a process to kind of figure out what's going on, but I think the most important thing is to get a good background on, what happened. We're trying to figure out, when did you start noticing those issues? Was it just acutely like yesterday, or was it a couple weeks ago? And you also want to kind of just have a look at where the horse is located as well too. Like, are we outside? Did the injury happen outside? Was it in the stall? Or what kind of environment are they living in that could have resulted in whatever happened to them? The other thing is, once you start putting hands on the horse itself, you'll notice, like, if they're having an ocular problem, they're going to be more shy on that side too. So what I usually like to do is I take a step back. If the horse is in a stall, I step back and I let them behave how they would in the stall without anybody putting any hands on them, just to see how they're behaving, how their comfort level is, and how they're acting as well too, because that can sometimes give you a really good idea on how they're feeling, like how uncomfortable they truly are. And, once we get in there, that's when you want to look at everything involved. So I always start looking from outside inwards. So I look at externally. I look at the face. How are we looking in general? Do we see him uncomfortable? Is there a grimace that we're seeing? Do we see discharge? Do we see asymmetry in the face itself? And then I evaluate, the light reflexes. Do we respond to bright light? Do we respond to hand motion? What is the pupil doing in that situation? And that's when I get a little bit closer, start looking at the different aspects of the eye, look at the back of the eye as well too. But I always try and be as systematic as I can, but I always like to kind of, start from afar and then work my way in. And I always try and, look at normal first and then abnormal, because a lot of the times, first thing you want to go to is you want to go to that eye that's problematic, but I want to have a general baseline. I want to make sure that I'm looking at all aspects of the eye, even the normal eye as well too.
So you mentioned horses have really strong eyelids, which they do. How do you get around that when you're performing your examination?
You guys amaze me. I've been around Dr. Latimer forever, and I got both hands up there prying this thing open. She just flicks it open, and they just obey.
Yeah, it's sort of like Jedi mind trick on the eye. Yeah, this is not the eye you're looking for.
Anyway, if you would tell us that secret, I would appreciate it.
I feel like maybe it's just finger strength practice. I don't know, a lot of opening of eyelids, that they're really strong, but they have a little superciliary groove, which is kind of the little area in between their eyelid and kind of the top part of their skin area of the orbit, and I just kind of stick my fingers in that groove and try and lift up. But you do have to, you have to go slow with these guys. A lot of the times, if you rush too quickly when you're trying to look at their eye, they're going to fight you. They're going to be shy. And so I think we spend a lot of time, working on our relationship with that patient to let them know that we're not there to hurt them or do anything. You want to just go really slow when you're looking at the eye. And if they're very painful in that situation, then I don't want to fight that. And so if we need to sedate the horse and then do some local blocks to facilitate our exam, then that's the best way to make things as comfortable as possible, especially if you're dealing with an eye that's very delicate. You don't want to, put too much pressure on the globe itself. And so I think it depends a lot of the times on what you're dealing with, what the patient's behavior is like, and kind of work with whatever you have, but always know that you do have the ability to sedate them and use local blocks if needed to facilitate the exam.
Yeah, those are excellent points.
Yeah. One thing that's always impressed me by watching an ophthalmologist such as yourself looking at an eye is the range of equipment that you have. So the eye is open because you made it open or you had to block it. Walk me through the instrumentation that you actually use to look at the various layers of the eye and what the things you see, what they mean to you.
Yeah, so we have a lovely microscopic device called a slit lamp, it looks like a little microscope, which is nice, and that's basically what it is. It allows increased magnification on what we're looking at. And so the nice thing about the slit lamp is that, you can only see what you can see with the naked eye, but the slit lamp is like, you can go up to 16 times magnification with that. And so the structures that we're seeing, you may not be able to pick up with the naked eye, but you can see that with the slit lamp. And we can see, changes in the vascular pattern. If there's a pattern in the cornea, we can see if there's spots in the cornea that you might not be able to see in the naked eye. But it also allows us to, see into the other aspects of the eye. So whether or not we have any inflammation in the eye, so we look for flare. We have the ability to turn it to a very small beam to be able to catch those changes, which is like increase floaters in the anterior chamber or cellular debris. And then we can also look at the lens itself too with that device, where we can see if there's opacities in the lens, which are known as cataracts, and we can kind of distinguish what type of cataract it is. And it also allows us to look into the vitreous as well too. So it's a really handy device on that aspect because we cover so many parts of the eye. The other thing that we use is an indirect headset, which is basically allows us to look at the back of the eye, so the retina, the optic nerve, and we can see changes there. And sometimes we may see changes that you won't be able to pick up with the naked eye because that allows us to, see a magnified view, but also see the periphery as well, too, of the retina.
The pressure within the eye is important, and there's something called a tonopen. Could you talk to us about that?
Yeah, so tonometry is basically the measurement of intraocular pressure within the eye, and there are a variety of different types of tonometers that are available. There are two types that were probably most commonly known to use, which is a TonaPen and a TonaVet. And those two both measure intraocular pressure, but they measure it a little bit differently. So the TonaPen, it's known as an aplantation tonometer. So basically what that means is that we actually touch the tip of that probe onto the corneal surface, and the pressure that we ignite by doing that gives us our pressure reading. The other tonometer that's commonly used is called a TonaVet, and that is a rebound tonometer, and its little probe actually rebounds off the center of the cornea, and it gives us our reading, and they both measure it in a little different way, but we still get an intraocular pressure reading of both, and they're relatively comparative, but there are differences with both readers that we have, and Dr. Latimer uses a TonaPen, and then I will be using a TonaVet.
Mm-hmm. Can you talk a little bit? You talked about using nerve blocks in some of these horses. Can you talk about what those different nerve blocks do and how they benefit you in both your exam and your treatment of the horse?
Yeah, so the most common nerve blocks that I will use to kind of facilitate an ophthalmic exam in a horse is the auriculopalpebral block and then a supraorbital nerve block. The most important is going to be our auriculopalpebral nerve block. So this block is important because it blocks the motor function to the eyelids, both the upper and lower, which allows us to, lift up those lids without having to fight them. The supraorbital nerve block is better for sensation to the cranial third of the eye itself. Doesn't block it completely, but if you can put both at the same time, it's great. But if you're stuck in a situation and you only have the opportunity to do one nerve block, the auriculopalpebral nerve block is going to be your go-to just because those eyelids are so strong.
Mm-hmm. Yeah.
Is there ever a time when the horse's vision is a problem when you're working on the eye, and can you block that horse so they can't see what you're doing?
Yes. So a lot of the times, if we are doing a procedure that we don't want the horse to be able to see, feel, or move their eye, there is a nerve block called a retrobulbar nerve block that can be done, where we're actually putting our local block, which is usually mepivacaine or lidocaine, kind of into the aspect of the orbital cone. And that is going to basically paralyze their ability to, move the eye, to be able to see. And it just makes it easier because, they don't have the sensation of knowing what's going on, but also feeling what's going on while we're doing that procedure. And that is a lot of the times why we're able to do standing surgeries in horses, standing ocular surgeries, because we have the ability to do that nerve block. And it usually lasts for about 4 to 6 hours after.
That's impressive stuff. So we're talking about ulcers today. So when you're looking at the eye with your slit device that you're talking about, what do you see with an ulcer? And when you're looking at that ulcer, what makes you more or less worried?
Yeah, so when I'm looking at ulcers, I'm looking for basically a break in the surface epithelium, which is the most superficial aspect of the cornea. The cornea is made up of primarily 4 layers, and any layer can be affected by ulceration, basically. And so when I'm looking at an ulcer, I'm looking for a defect in the cornea, so a wound. And what worries me if I'm looking at a defect in the eye is if I see, a lot of haze associated with it. So a cloudy appearance, maybe it gives a bluish appearance, which is a sign that there's fluid building up in that area. If I see white, that also has me worried because white means inflammatory cells. And if there are inflammatory cells, I'm always worried that there's infection in the cornea, whether it's bacterial or fungal. And then also the depth of where that defect is. Our cornea has multiple layers, but if you've got an ulceration that's very, very deep, that makes the eye at a higher risk of potentially rupturing or perforating.
Yeah, that's a frightening thing when it actually happens because unfortunately sometimes they come in like that and it's sort of game over. You talked about bacterial, but what about fungal? What's particularly concerning about fungal ulceration, and is that sort of more or less likely to be in this area than in others?
So yeah, whenever I deal with fungal ulceration, I always worry because fungus is aggressive. It likes to cause a lot of local destruction to the normal corneal tissue, and it almost breaks down the tissue relatively quickly too. The problem with fungal organisms is that it does have a preference to dive deep into the cornea. It likes to hang out in one of the deeper layers, which is Descemet's membrane, and it can cause a lot of local inflammation in that area, but also the infection is so deep that sometimes it makes it hard to get the treatment that we need to that area. And with fungus itself, it is in any horse environment, but I do think, there's a higher risks environment for sure where we're located, specifically just because of the temperature that we kind of live in. We have some cold, but also some warmth. And the barns that we're keeping a lot of our horses in, they're humid, there's hay, there's a lot of factors at play that just makes them at risk for a fungal infection. And there's just, I feel like when we're looking at some of the cases that we're seeing, there are certain barns that we're getting horses that have more horses of cases of fungal infection than others. And so I do think, the environment plays a big part in it. But if I do see an eye that has fungus associated with it, I always tell clients, it's a 50-50 shot if we're going to be able to, get this under control, because we're not only fighting against a fungal infection, we also have to think about, preventing bacterial overgrowth. We also have to think about controlling inflammation associated with that fungus infection too. And that inflammation is going to be what causes the most discomfort for our patients.
You mentioned about the difficulties of getting treatments and medications to these fungal ulcers because they're so deep. I'm sure anybody that's ever treated a routine, if there is such a thing, ulcer on the horse, topical medications. So how do you get the medication to the point that it can be effective on these fungal elements? I mean, what do you have to do differently with fungal ulcers?
We always say, treat them aggressively, and by aggressively, we mean treat them very frequently. And so a lot of these horses, they need to be treated every hour, every 2 hours at the beginning to really get the concentration of the antifungal that you need to get there. We're lucky that we have a lot of antifungals available to use, but each of them have their limitations in regard to how well they can penetrate through the cornea itself. But there are ways that we can get the drug deeper into the area of infection. And so we can do local injections into the cornea called intrastromal injections, where we basically put a depot of a high concentration of that antifungal around the site of infection to help kind of hit it a little bit more aggressively. But it's a combination of both topical medical therapy, sometimes even oral antifungals on top of that, in addition to doing the injections. And if worse comes to worse, there's also the opportunity that we can do surgery to cut out those deep infections as well too. But you want to kind of save that for the worst case scenario, because again, doing surgery to cut out a deep infection is an invasive procedure. There's always a risk that you don't get all of the infection out. And so we try and kind of pick the best cases that we can, but sometimes that is a limiting factor too.
Yeah, anything surgical on the eye just looks extremely delicate to me. So sounds like this is something that has to be done from time to time, and it sounds like you're adept at this. So what decision do you make? What is the process to say, okay, this one I have to address surgically, and what happens after that surgery? Because now you're going to have a defect in the cornea, which is not very thick. So how do you make the decision to make the surgery, and how do you manage those afterwards to give you a better chance of success?
I kind of gauge just how that patient is responding to treatment. I always try and, use medical management with topical therapy, local injections as best as we can. But the cases that we need to think about are the ones that are not responding to therapy as well as we'd like them to. We're hitting them with everything we can give them topically, but we're not seeing the response that we want to. Things that we have to consider is also the size of the lesion that we're working with too, because like you said, we're going to be removing a large part of a deep part of the cornea, and so having material to be able to fill that area is a little bit of a limiting factor for us, because yes, we can get donor cornea, we can get other biological material as well too, but having to kind of fix a hole in a very deep area is very risky because the cornea itself is going to be very delicate. And so I think it really just, depends on the lesion that we're seeing, the response to therapy, and also the size and where it's located as well too, because we're trying to, save the eye as best as we can, but also give optimal vision if we can for these cases too. So that is something that we need to consider, is how much is this surgery going to potentially affect their vision. But in regards to the aftercare for a procedure like, we call it a posterior lamellar keratoplasty, which basically means cutting out that deep part of infection, it's still going to be the same. They're still going to be on topical medical therapy, but they'll have a lot of sutures in their cornea. And this is very, very small suture. And that suture can take up to 4 to 6 weeks to dissolve. And so that will still require treatment in the long term. So it's not a short, cut them out, you're done with it kind of thing. There's still a lot of maintenance that needs to be done with these horses, but they do recover and they can be very successful after.
Some horses really resent treatment. How do you handle those horses that need treated every hour, every 2 hours, or for extended periods of time? Because those can be fairly difficult.
Yeah, we are very lucky in this day and age that many people have developed different ways to, medicate. But we do have a system called a subpalpebral lavage system, which is basically almost like a catheter that we put in through the eyelid that allows us to treat a horse's eye multiple times a day without having to even pry open their eyelids. And a lot of horses can have that I've had horses have that in for months at a time, just because they just require treatment. But it makes it a lot easier for maintenance in the hospital setting, but also at home too, because you have that device. You have the ability to treat the horse as often as it needs to with many medications, but owners are also able to use that in their home setting as well too. And there's maintenance. You have to watch the tubing, make sure it doesn't slip out, but it makes it easier to treat horses more intensely. And at some point, some of the horses will get tired of it, but most of them do tolerate it relatively well. And some horses can get ridden with it in place. Some horses are turned out in it and they don't bother it at all. But it's a very, very nice system that we have that allows us to treat horses without having to really manipulate around their face.
Yeah, because some of them they just resent it.
Oh, yeah.
It's hard, and those are lifesavers, eye savers.
Yeah.
Anyway.
So besides the infection, you mentioned inflammation was a big component of the disease in these horses. What are the tricks to actually control that inflammation?
Yeah, so the inflammation that we tend to kind of deal with the infection is usually a secondary inflammation, and that's just a response to whatever infection is going on within the eye itself. And so the mainstay of treatment for that is usually, for topically wise, we use atropine, which is a mydriatic. It dilates the pupil. Which is great. But the other thing that atropine does is it paralyzes the iris and the ciliary muscles, which are often spasming and twitching, which is why our patients are uncomfortable in the face of inflammation. And so by paralyzing those muscles and opening up the pupil, we get improved comfort from that. And then on top of that, we'll put them on a systemic anti-inflammatory. So Banamine is our go-to. It's the greatest for ocular inflammation in my mind, and sometimes we have to hit them with pretty aggressive doses of Banamine at the beginning to get that inflammation under control, but it is probably one of the best medications that we have to tie with atropine to get that inflammation quiet.
Yeah, this sounds like, as you say, you're talking months with a lavage, and this sounds like this is not like one and done. And so how do you cope with client fatigue in these situations?
Yes. So I always think about, what can the client do at home? What can I do to make it easier for them? But I have to say, I feel like the clients that are, bringing their horse in to see an ophthalmologist are probably one of the most dedicated clients that we have there. But I always like to, get a better understanding on what they can do at home and what they can't do. And I try and make it as easy as possible, but I also, warn them that this is a long process. It's not just a cure-all a week later kind of thing. With these infections, they can be horrendous and they require long-term treatment. And that's something that I always prepare them for right at the beginning. Once we see that horse, we know that there's a really bad infection going on. I tell them, here are treatment options. It's going to be a long-standing treatment and it's going to be very, very tiresome, but there is a light at the end of the tunnel. And that light is usually what kind of gets them through it. But we may have them on medications like every 2 hours at the beginning, but that's not for the entire period. As the horse continues to improve, the lesion is looking better. We try and cut down medications as much as we can to still treat what we need to treat, but also be reasonable with everybody's lifestyle as well too. And so I think, when we get to that, closer to that light at the end of the tunnel, they see that and they keep pushing, and they usually will push through, which is the best thing.
It never ceases to amaze me how eyes can heal, because they come in and they just look really in trouble. And clinicians such as yourself work your magic, but also the eye's inherent ability to heal itself when the environment is created. But you did also mention that 50-50 with these fungal ulcers. So should we get to the point where things aren't going well, what happens at that point, and how does the horse tolerate any sort of treatments for the eye that doesn't respond?
Yeah, so the 50-50 aspect is something that, I think I will still live by regarding these infections. And, you can try everything that you can to manage it, surgery, medically as well too, but at some point, sometimes you can't get that infection under control. And the next best thing is to have that eye removed with an enucleation. And it's a horrible thing to think about because, you never want to do that. And for me, enucleation is kind of like the end all, we're taking the eye out. But we also have to think about the patient as a whole. If that eye is causing such pain, such grief that we are getting changes to that animal systemically, it's not something that's worth keeping just to have, And I think it goes with even chronic disease that we see in eyes of horses that have like chronic uveitis in that aspect too, is that there is pain associated with the eye, and that pain is always going to, linger and be there. And so if we're thinking of the best thing to do, taking out the eye is sometimes the best thing to do. And you almost see like an instant relief in these horses. Once that eye comes out, they're recovered from surgery and they're happy as can be. They're back to their normal behavior and they do really well. It's an adjustment period for them, but I feel like it's more of an adjustment period for us, ourselves, more so looking at the animal. But the horse itself, they go back in the field, they go and hang out with their friends, and then they go and they can win races and win competitions with one eye, and they still are happy with what they're doing, but they don't have that pain anymore.
Yeah, I mean, absolutely sort of vote for you on that one, because they have these horses and, there's so much pain involved, and the horse is in the back of the stall. The eye comes out, the horse is at the front of the stall, cleaning up its feed bucket, starts interacting with you again. And I mean, the client may have a bit of an emotional response to that eye coming out, but when they see how much better the horse is, they realize that they shouldn't have feared the enucleation. Like, we're all here to save the eye. But if it can't be saved, it makes such a difference to that horse to have that eye out. Because you say the pain must be just, with all the medication they're on, if they're still that painful, I mean, it must be just something we can't comprehend.
Yeah, ocular pain is no small feat for sure. I mean, I think I talk to people who have had, ocular issues themselves too, and they always are like, we get it. We understand why the horses are behaving the way that they are with what they're dealing with, because it is painful and it is probably one of the worst things to have to deal with. And if you can imagine having such a severe infection in that eye, it just, you can take a toll on the body as a whole completely, you know.
So there's an owner listening that thinks they may have an ulcer in their horse's eye. What don't you want them to do before they call you for an evaluation? I
don't want them to put any steroids in the eye itself. And so if you have a corneal ulceration and you accidentally put a steroid in the eye, that can actually make the infection significantly worse. And corneal tissue can break down, they can get melting ulcers, and so that's definitely something you don't want to do. Honestly, with any ocular issue, I think the first thing you should do is call your veterinarian, because you don't want to wait with any eye problems. You know, they can get bad very quickly, and so if you have any concern, you call your veterinarian and you have them have a look and see what's going on, because the worst thing to do is wait and then be too late.
From a practical perspective, one of the things that we deal with a lot, the people across the United States do, is fly control, and that's something that's on their faces. Can you talk about the benefits and the risks associated with horses wearing fly masks?
So the benefit is they have protection from the flies itself, but also from their environment too. And there's a lot of different types of fly masks available. You've got like the UV protected ones. Some of them have a hoop in front of them that gives them a little bit of space in between. Some of them have cups as well too. And I think with the fly mask aspect, I think every horse that's outside would probably benefit from a fly mask if they keep it on themselves and don't pull it off each other. In the aspect that it just helps with protection. Some things that I do worry about is that, you have something on your face for too long, you can get, pressure sores on the face. If it's very, very wet, they can get really moist underneath there. And so it's really important, if you are going to put a fly mask on, is to also check underneath the fly mask to see what's going on underneath there. But I think a lot of the times the benefit of a fly mask outweighs the risk, as long as you're aware of what you need to kind of look out for.
Yeah, and that's a very important point. And that's kind of what I was leading to. If you're gonna have a fly mask on, you got to look under that thing every day, because because as you talked about what owners see with that fly mask on, they're not seeing their eyes, and if you're going sometimes days and days without looking underneath there, they can develop problems pretty quick, and by the time they actually see what's under there, you've got a severe problem.
Well, you don't want to swap one trauma for another, right? You're trying to avoid all the other issues, and then you make it worse. The treatment becomes or the preventative becomes a disease, and then we're in a worse position.
Yeah, it's just something you got to keep an eye on.
Yeah. Oh, no pun intended.
Yeah.
So this has been great. Thanks for coming to see us today and talking about ulceration, especially fungal ulceration, because as a clinician, when these things come in, I get really worried about the involvement of fungus, especially around here where, as you pointed out, it's sort of so humid and there's so many irritants in the environment.
Yeah. Yeah, no, excellent discussion. Thank you for being with us today.
Thank you for having me.
Yeah, no, it's been great, and welcome to the practice.
Thank you.
Yeah, and that's StallSide for this week. We've been talking to Dr. Kim Lam about equine corneal ulceration, especially fungal. See you next time.